Hello and welcome to videocast series on hospital departments and allied professionals. I'm your host, Dr. Cornejo, and I'm thrilled to guide you through this essential topic in healthcare management. In today's videocast, we'll be exploring the foundational concepts that impact not just doctors and nurses, but every healthcare professional who interacts with patients. By the end of this class, you'll be able to describe the broad spectrum of negligent errors committed by various healthcare professionals, discuss why certification and licensure are vital, and identify the main reasons licenses can be revoked. Explain the purpose of the Emergency Medical Treatment and Active Labor Act in ensuring equitable patient care. Highlight the importance of a multidisciplinary approach to patient care. We'll delve into the ethical and legal frameworks that govern daily practice, covering proper assessment, diagnosis, treatment, and follow-up. You'll also hear real-world legal cases with lessons that apply to every professional in the healthcare arena, whether you're an aspiring clinician, a seasoned healthcare administrator, or simply curious about how hospitals run behind the scenes. Stay tuned. We're here to shed light on the responsibilities, challenges, and collaborative efforts that define modern patient care. Thanks for joining us. Let's jump right in. So, in this slide, we can see the case of paramedics and first responders, such as emergency medical responders, emergency medical technicians, and advanced emergency medical technicians play a critical role in providing immediate care. In this slide, we see potential issues they may face, including administering the wrong drug dosage and challenges in diagnosing the extent of injuries. Good Samaritan statutes can offer legal protection when care is given in good faith, but malpractice limitation statutes do not always apply. Errors such as incorrect medication dosage by an emergency medical technician could lead to license denial. Additionally, if a patient refuses transport and subsequently dies, it raises further liability concerns. These points highlight the delicate balance of clinical judgment, legal obligations, and professional standards in emergency care. So in this slide, we can see that healthcare managers oversee the emergency department to ensure that all patients are treated regardless of their ability to pay and that immediate, thorough assessments occur. Treatment must begin as quickly as possible with the goal of maintaining or restoring health. Managers coordinate resources to minimize scarring and deformity by enabling rapid interventions and ensuring appropriate specialist involvement. Effective triage protocols, adequate staffing, and continuous training are essential for delivering high-quality care. By providing streamlined processes and support, healthcare managers help fulfill legal and ethical responsibilities and improve overall patient outcomes in this fast-paced, critical setting. Failure to admit. When a patient in need of urgent care is not admitted or monitored quickly, it can lead to serious harm. Healthcare managers must ensure that the emergency department has protocols requiring rapid triage, assessment, and physician evaluation. Documentation of vital signs, especially respiratory rate, is essential to detect changes early. If nurses and physicians fail to meet these responsibilities, the hospital may bear liability for negligence. Prompt care, continuous monitoring, and accurate record keeping can mitigate adverse outcomes. By establishing clear procedures and regularly supervising staff, healthcare managers foster an environment that upholds legal standards and protects patient well-being. Emergency Medical Treatment and Active Labor Act. In 1986, Congress enacted the Emergency Medical Treatment and Active Labor Act, forbidding hospitals that accept federal health program reimbursement from turning away patients without appropriate care. Under 42 United States Code, Section 1395, any individual who comes to the emergency department requesting treatment must receive a medical screening examination to determine if an emergency medical condition exists. This requirement applies regardless of the patient's ability to pay or insurance coverage. If a patient's condition is deemed urgent, the hospital must either stabilize the patient or arrange a safe transfer. Healthcare managers play a critical role in ensuring compliance by establishing clear policies, providing staff education, and monitoring performance, all to protect patient rights and promote equitable access to emergency care. EMTALA tax cases. These examples highlight key obligations under the Emergency Medical Treatment and Active Labor Act. A valid claim often arises if a patient is not stabilized before discharge or transfer. Hospitals must ensure that all individuals receive necessary care, so failing to admit a patient with an urgent condition can result in liability. Although a racial discrimination complaint may be dismissed for lack of evidence, hospitals can still be at risk for inappropriate transfers or allowing a patient to depart without proper discharge instructions. By diligently stabilizing patients, admitting those who need further treatment, and following safe transfer protocols, hospitals uphold legal standards and protect patient welfare. Failure to admit. In this situation, the physician was deemed negligent for not hospitalizing the patient when she first sought care. The court determined that her likelihood of survival would have been significantly higher with immediate admission. For healthcare managers, this underscores the importance of proper protocols and training that help providers recognize when hospitalization is necessary. Clear guidelines, regular staff education, and effective triage systems all contribute to preventing fatal delays in care. By ensuring that policies are consistently followed, especially in cases where a patient's condition indicates urgent intervention, healthcare managers play a vital role in reducing liability risk and improving patient outcomes. Patient left without proper discharge. In this situation, a court found that an emergency department nurse had no legal obligation to prevent a patient from leaving voluntarily without receiving proper care. This decision highlights the importance for healthcare managers to establish clear protocols, informing patients of the potential risks if they decide to leave before completing treatment. Although a nurse may not be legally bound to physically prevent someone from departing, managers can develop policies that require thorough documentation, additional patient education, and formal consent or refusal forms. By ensuring these measures are in place, healthcare managers help reduce liability, encourage informed decision-making, and protect both patients and staff when individuals choose to leave against medical advice. Wrong record, fatal mistake. In this tragic scenario, the physician relied on the wrong patient chart, leading to an improper discharge. By the physician's own admission, this mistake directly caused the patient's death. Healthcare managers can help prevent such errors through strict identification protocols, regular training, and reinforced documentation procedures. Ensuring that staff consistently verify patient information before making critical decisions can avert devastating outcomes. Managers should also encourage a culture of accountability and teamwork, where communication is clear and any doubts about patient records are promptly addressed. These measures protect patients, reduce legal risks, and uphold professional standards. Duty to contact on-call physician. Hospitals must promptly notify on-call specialists when their expertise is needed in the emergency department. A timely response is essential for delivering appropriate patient care. When a hospital fails to contact an on-call physician, or a physician does not respond as required, liability concerns can arise. If the physician is unable to respond, formal notice should be provided so alternative measures can be arranged. Telephone consultations alone can be expensive and may not meet the standard of care in critical situations. By establishing clear protocols and monitoring response times, healthcare managers help ensure effective communication, reduce risk, and maintain a high level of patient care. Telephone medicine can be costly. In this case, the physician only provided a telephone consultation and prescribed a medication without reviewing the patient's vital signs or ordering necessary laboratory tests. The patient, whose glucose level was extremely elevated at admission, suffered respiratory failure and died. The court found the physician liable for negligence, awarding compensation for the patient's pain and suffering. Although the defendant argued this amount was excessive, the appellate court upheld the trial court's decision. For healthcare managers, this underscores the importance of ensuring proper in-person evaluations, especially for potentially critical conditions. Relying solely on phone communication without complete clinical information can lead to dire outcomes and legal liability. Improving care in the emergency department, ensuring courteous and prompt treatment regardless of a patient's ability to pay, is a core principle of exceptional emergency department management. Healthcare managers can improve outcomes by providing sufficient staff levels, demanding prompt, on-call physician response, and creating an environment where every patient complaint is taken seriously. Triaging patients by severity ensures those with life-threatening conditions receive priority care, while thorough assessments are conducted for all. Finally, clear, consistent communication helps staff accurately capture and interpret patient symptoms, facilitating timely, effective diagnosis and treatments. This approach strengthens patient trust and enhances overall quality of care. Continuing with the improving care in the emergency department cases, we can see in this slide that obtaining patient consent when possible ensures respect for individual autonomy and promotes transparency. Hospitals should also establish a clear mechanism for requesting specialist consultations so that complex cases receive timely expertise. Each facility must determine which patient types and care levels they can safely handle, enabling them to make sound judgments on when to admit or transfer. Careful, ongoing review of medical records for every patient treated is crucial, both for legal compliance and continuity of care. Finally, regular education programs help keep staff up to date on best practices, new technologies, and evolving guidelines, thereby enhancing patient outcomes and safety. Now let's talk about the case of improper transport. So if Hospital A lacks critical stroke care services, while Hospital B offers a full range of specialists and facilities just 1 mile away, transporting a suspected stroke patient to Hospital B is generally the safer choice. Going to a hospital without the necessary stroke team or trauma services can delay essential treatment, raising serious ethical and legal concerns. Patients have a better chance of survival and recovery when they receive prompt specialized care. Hospital B would be the first choice if the patient's condition clearly calls for advanced neurological support or if standard transport protocols indicate the need for a specialized center. Ensuring that individuals are taken to the most appropriate facility aligns with both professional standards and legal obligations. Now let's talk about laboratory services. Hospitals are required to provide clinical laboratory services or arrange them through reputable licensed providers to meet patient needs. Studies suggest that up to 70% of medical decisions rely on common laboratory tests, such as blood and urine analysis and tissue biopsies. Accurate and prompt results are essential to effective diagnosis and treatment, and errors can lead to severe harm or even death. Because many healthcare organizations contract out laboratory testing, they must select laboratories committed to quality and timeliness. A well-managed lab or contracting process supports critical functions, monitoring therapeutic ranges and medication levels, guiding clinical decisions on antibiotics, providing staff education, for instance, in glucose monitoring, and supplying data for research. In addition, implementing performance improvement processes can reduce delays and mistakes by measuring factors such as sample collection, transport, and result reporting. Common laboratory errors include incorrect sampling, labeling, contamination, and misinterpretation of results, all of which can seriously compromise patient care. Now let's talk about the case where there's a failure to detect changes in medical problems. In this case, the court allowed evidence of negligence related to Pap tests taken more than 2 years prior to the lawsuit because the patient had an ongoing relationship with the laboratory. Her physician repeatedly sent her Pap tests to that same facility over an extended period, establishing a continuous pattern of care. Consequently, the laboratory's earlier actions remained relevant. For healthcare managers, this highlights the importance of overseeing consistent, accurate testing practices and ensuring thorough follow-up on any abnormal results. A single error in interpreting a Pap smear can have serious consequences, and a long-standing patient-laboratory relationship may expand the legal time frame for liability. By implementing robust quality assurance programs and fostering clear communication with physicians, managers help safeguard patient well-being and minimize legal risk. Laboratory cases. Preventing critical errors. Errors in laboratory work can lead to serious patient harm, particularly if test results are misread or misdiagnosed. Swapped blood samples or confusion with specimens can produce inaccurate lab findings, which may delay proper treatment or lead to wrongful interventions. Failure to follow transfusion protocols, such as verifying blood type and matching patient identifiers, can cause mismatched blood transfusions, potentially resulting in life-threatening reactions. Healthcare managers should implement rigorous checks at each stage of specimen collection, labeling, testing, and transfusion. Regular staff training and strict adherence to established guidelines help minimize these risks, protecting patient safety and maintaining quality standards in laboratory services. Medical assistants. Medical assistants are unlicensed personnel who support licensed practitioners by handling administrative tasks, office procedures, and certain technical duties. They often work in clinics or physician offices, ensuring that operations run smoothly. This role includes tasks such as greeting patients, scheduling appointments, managing records, and preparing exam rooms. Employment opportunities in this field are projected to grow much faster than in many other professions, partly due to an aging population and the expanding need for healthcare services. In larger practices, medical assistants may specialize in a specific area, such as pediatrics or dermatology, all under the direction and supervision of a licensed healthcare professional. Their versatile skills and adaptability make them indispensable members of the healthcare team. Nutritional services. Healthcare facilities carry a fundamental responsibility to ensure patients receive adequate nutrition. When this duty is neglected, legal problems can arise, particularly for vulnerable individuals such as those in nursing facilities. Implementing clear policies and procedures, including regular assessments of dietary needs, continuous staff training, and immediate intervention when nutritional concerns emerge, can help protect patients from harm. By prioritizing appropriate nutrition, facilities improve overall care quality and minimize the risk of potential legal complications. Pharmacy services healthcare managers recognize that the ever-growing variety and complexity of medications make it challenging for physicians and nurses to maintain full expertise on every new drug and dosing requirement. As a result, the pharmacist's role has expanded to become integral in modern hospital practices. Pharmacists provide valuable guidance on dosage, interactions, and proper administration, helping reduce medication errors and ensuring safe, effective treatment. They also collaborate on formularies, educate clinical staff, and contribute to performance improvement initiatives. By supporting a culture of interdisciplinary teamwork and continuous learning, healthcare managers ensure pharmacists can effectively assist in safeguarding patient outcomes through knowledgeable and proactive medication management. Common prescription errors. In the fast-paced hospital environment, errors can arise when prescribing medications. Selecting the wrong patient, writing down the wrong medication or dose, using the incorrect route, or giving it at an inappropriate frequency are all potential pitfalls. Transcription mistakes may occur due to poor handwriting, unclear abbreviations, or communication gaps. Failure to thoroughly assess a drug's suitability for an individual patient by evaluating allergies, potential interactions, and other factors can also lead to adverse events. Healthcare managers can help minimize these risks by fostering clear documentation standards, encouraging consistent use of technology such as electronic prescribing, and supporting thorough staff education on best practices. By doing so, managers create a safer healthcare environment for both patients and practitioners. Common dispensing errors. The process of dispensing medication involves multiple steps that, if poorly managed, can compromise patient safety. One frequent error is the improper preparation of medication, where incorrect mixing or compounding can impair efficacy or cause adverse effects. Additionally, failure to properly formulate medications may lead to subtherapeutic dosing or toxicity. Dispensing expired medications is another critical concern, as potency and overall safety can diminish beyond the expiration date. Further, mislabeling containers raises the risk of patients receiving the wrong medication or instructions. Errors also arise from providing an incorrect dose, which can stem from oversight or confusion during dispensing. Finally, misinterpretation of a physician's order, often exacerbated by poor handwriting or incomplete documentation, can lead to inappropriate treatment. Adhering to standardized protocols, integrating technological tools, and emphasizing staff education are essential measures to reduce these errors and safeguard patient health. Common documentation errors. Mistakes in transcription often stem from illegible handwriting or the improper use of abbreviations, resulting in confusion about a patient's medication needs. Inaccurate entries on the medication administration record can lead to discrepancies between what is prescribed and what is actually given. At times, a medication is charted but never administered, whereas in other instances, it may be administered yet remain unrecorded. Discontinued orders can stay active in records if staff fail to note updated instructions, and medication that's wasted should always be documented accurately to prevent misuse or billing errors. Ensuring clarity in documentation practices and encouraging clear communication among caregivers can greatly reduce the risk of harm and enhance patient safety. Control of drugs. Drug regulation is guided by federal laws such as the Controlled Substance Act and the Federal Food, Drug, and Cosmetic Act, which govern the classification, distribution, and safe use of medications. At the state level, additional regulations may set forth storage requirements and dispensing rules. Within hospitals, the formulary lists approved medications and helps ensure consistent prescribing practices, cost effectiveness, and safe administration. Meanwhile, pharmacists' responsibilities have broadened beyond dispensing and verifying prescriptions. They now play an active role in clinical decisions, patient counseling, and staff education. Together, these measures, adherence to legal standards, proper storage, and an evolving pharmacy role strengthen the organization's capacity to provide high-quality, compliant care. Medication checklists, ensuring safe practices. A well-defined medication checklist helps reduce errors by standardizing how orders are written, communicated, and administered. Legible handwriting or printing when clarity is needed prevents confusion, while avoiding felt-tip pens can maintain readability over time. Abbreviations should align with hospital policy to minimize misinterpretation, and ambiguous instructions should be avoided altogether. Adding a zero before a decimal, such as 0.5 instead of 0.5, prevents dosage errors that could harm patients. Orders placed on hold must include a clear time frame to guide staff actions. Prescribers should be familiar with the medications they order, ensuring the correct route, oral, intravenous, and so forth, is used. From a healthcare management perspective, enforcing checklist compliance promotes a culture of safety, preserves patient trust, and mitigates legal and financial risks for the organization. Expanding role of the pharmacists. Pharmacists have taken on a broader set of responsibilities that extend beyond simply filling prescriptions. They monitor patients' medications, often leveraging computer systems capable of detecting potential drug-drug or food-drug interactions. Although pharmacists alert patients to possible overdose risks, their duty to warn is inherently limited. They cannot realistically address every danger associated with every drug. In some instances, pharmacists may refuse to honor a prescription if there are ethical or safety concerns. Many also handle specialized services such as intravenous admixture, ensuring proper sterile compounding and administration of drugs. Addressing the opioid epidemic has become another focal point, requiring vigilance in dispensing and collaboration with prescribers. Likewise, pharmacists must communicate with physicians, particularly when data are incomplete or contradictory, to optimize patient outcomes. The rise of internet pharmacy introduces new challenges as pharmacists guide patients in navigating legitimate online sources. Finally, providing helpful tips to patients, from correct dosing to recognizing side effects, rounds out a more consultative, patient-centered practice. From a healthcare management perspective, giving pharmacists the tools, authority, and support to perform these tasks is critical for safe, efficient, and cost-effective medication use. Physical therapy combines both art and science to prevent and treat neuromuscular or musculoskeletal disabilities. Therapists evaluate each patient's limitations and rehabilitation potential, then develop individualized care plans. These plans include various treatment modalities: heat, cold, ultrasound, electrical stimulation, and other physical agents designed to reduce pain, improve mobility, and restore function. Neuromuscular procedures such as therapeutic exercises and manual techniques, further enhance strength and coordination. From a healthcare management viewpoint, allocating adequate staffing, equipment, and continuous training is crucial for maintaining high-quality therapy services. This approach ultimately boosts patient satisfaction, supports faster recoveries, and optimizes resource utilization. Now let's analyze the case of incorrectly interpreting physician's orders. So, a patient alleged that a physical therapist neglected the standard of care by ignoring his protests of pain and continuing treatments beyond the physician's instructions. According to expert testimony, the therapist deviated from accepted practice by introducing an exercise not prescribed by the doctor. The appeals court agreed with the trial court that the patient provide enough evidence showing a breach of duty. This highlights the importance of following physician orders and halting activities when patients report significant pain. Maintaining clear communication among the care team and exercising sound clinical judgment are crucial to protecting patient safety and avoiding liability. Case study: neglect, refusal to allow bathroom use. In this incident, care staff prevented a patient from using the bathroom before therapy, prompting allegations of neglect. The court reviewed the evidence and determined that the refusal supported the finding of resident neglect, emphasizing the duty of caregivers to address basic needs. For healthcare managers, the case underlines the importance of respecting patient dignity, ensuring staff follow protocols for fundamental care, and training employees to prioritize patient comfort and well-being. Case: termination of contracted services. In this situation, a hospital chose to establish its own physical therapy program, thereby excluding an external therapist. The court determined that the decision was within the hospital board's administrative discretion, underscoring the authority board's hold in managing facility operations. Additionally, the therapist entering the premises without a staff physician's permission constituted trespass and violated hospital policy. From a healthcare management perspective, this case highlights the need for clear guidelines on third-party service providers. Governing bodies must ensure that any policy changes align with organizational goals, maintain quality standards, and uphold legal requirements for staff and patient safety. Physician assistants must graduate from an accredited educational program and secure national certification, followed by state licensure to practice medicine under physician supervision. Each state outlines specific duties they may perform, such as diagnosing, treating, and prescribing. Although supervised, they remain personally liable for any negligent acts. From a healthcare management standpoint, diligent credentialing, regular performance reviews, and strict adherence to scope of practice rules are essential for maintaining quality care. Clear policies, ongoing education, and efficient collaboration between physician assistants and their supervising physicians help ensure patient safety, legal compliance, and an effective clinical environment. Respiratory therapists play a critical role in maintaining patients' airways and delivering appropriate respiratory care. Errors such as failing to remove an endotracheal tube when indicated can lead to airway complications. The multiple use of the same syringe compromises infection control standards, endangering both patients and staff. Furthermore, proper restocking of the code card is vital for emergency preparedness. Any lapse can delay life-saving interventions. From a healthcare management perspective, regular training, quality assurance checks, and clear protocols are essential to prevent these errors. Ensuring that respiratory therapists follow rigorous safety procedures not only protects patients, but also reduces legal and reputational risks for the organization. Social worker. Within a hospital setting, social workers play a critical role by addressing psychosocial needs, helping patients secure insurance coverage, guiding them through challenging care decisions, and coordinating post-discharge planning with families. Their commitment to ethical standards is underscored by the National Association of Social Workers Code of Ethics, which outlines 6 core purposes, such as promoting well-being, social justice, and professional integrity. From a healthcare management viewpoint, integrating social workers into care teams ensures a holistic approach, supports effective resource use, and helps reduce readmissions by equipping patients with the social, emotional, and logistical support needed to transition safely from hospital to home or another care setting. Certification of health professionals. Certification serves as official acknowledgement that a practitioner's skills meet the standards set by either a government entity or professional association. In some fields, not subject to state licensure, these groups define their own benchmarks for competence and safety. This self-regulatory process offers patients an assurance of quality care. Healthcare managers benefit from employing certified professionals because it elevates the organization's reputation, fosters consistent standards of practice, and reduces liability risks. By encouraging continuing education and recertification, managers help ensure that staff remain up to date with the latest developments, ultimately strengthening patient outcomes and organizational performance. Licensing of healthcare professionals. Licensing grants qualified individuals the legal right to perform specific healthcare activities. Typically, state licensing boards or agencies establish education, examination, and ethical standards to ensure competence. The primary objectives of these laws are to restrict entry to those who meet rigorous criteria and protect the public from unqualified practitioners by enforcing consistent practice guidelines. Licenses can be suspended or revoked if obtained fraudulently or when a practitioner engages in unprofessional, immoral, or illegal behavior, violates statutory prohibitions, or commits malpractice. From a healthcare management perspective, verifying that all employees hold valid and current licenses is crucial. It maintains compliance with regulatory requirements, protects patient safety, and upholds an organization's integrity within the healthcare industry. Helpful advice for healthcare providers. From a healthcare management perspective, adhering to one's professional code of ethics helps maintain integrity and trust within the organization. Criticizing a colleague's abilities can undermine teamwork, so any concerns should be addressed privately and constructively. Comprehensive medical records are vital both for continuity of patient care and for legal documentation. When clinical complexities arise, consulting a specialized practitioner ensures more accurate diagnosis and treatments. Providing clear explanations of risks, benefits, and alternatives promotes informed decision-making and fosters patient engagement. Active listening and allowing patients to share their worries create a supportive environment. Finally, ensuring proper administration of medication and closely monitoring patient responses are key steps in delivering safe, high-quality care. Continuing from the previous list, it is crucial for professionals to confine their work to their trained specialty and commit to ongoing education, staying updated on best practices. Patient confidentiality must be safeguarded at all times, reinforcing trust and legal compliance. Checking and maintaining any equipment before use further ensures patient safety. When ending a care relationship, offering proper notice respects patients' continuity of care. Authenticating telephone orders helps prevent errors. and arranging a qualified substitute during absences avoids gaps in service. Teaching patients about their conditions boosts adherence and empowerment. Lastly, open communication among providers and patients establishes trust and a genuine sense of significance in the care process. Chapter Review and Conclusion. Welcome to the conclusion of our videocast on hospital departments and allied professionals. As healthcare managers, it is crucial to understand the fundamental issues that influence legal compliance and operational efficiency. First, the Emergency Medical Treatment and Active Labor Act was enacted to prevent hospitals from refusing care to individuals who cannot afford to pay. By mandating medical screening and stabilizing treatment, this legislation safeguards patient welfare and promotes fair access to urgent care. Healthcare managers must train staff to follow screening protocols precisely and document each case thoroughly. Second, delivering medical advice by telephone can be beneficial, but must be approached with caution. Although offering immediate guidance may enhance patient safety, professionals should remain aware of the risks linked to incomplete information and possible misunderstandings. Implementing clear procedures, such as verifying patient identity, recording advice, and recommending in-person appointments when warranted, helps reduce liability. Third, prescribing and monitoring medications is an increasingly intricate process due to the proliferation of new drugs and regulations. Errors in ordering or administering treatments can have severe consequences for both patient health and an organization's reputation. Healthcare managers should encourage the use of reliable drug formularies, pharmacist reviews, and technological systems designed to detect possible adverse interactions. Finally, recognizing the difference between certification and licensing is essential. Licensure entails permission from a state regulatory authority to practice a defined profession, contingent on meeting educational and testing standards. In contrast, certification usually reflects a professional association's endorsement of specialized expertise and serves as evidence of advanced knowledge. However, it does not provide the legal authority to practice. By integrating these practices and principles, healthcare managers can establish a safer environment that places patient care and organizational integrity at the forefront,